Welcome, everybody. Today's webinar will be about social determinants of health and what we as Johnson Hall Labs do about it. So the slides will be about what's the importance of SDOH in healthcare and Johnson Hall Labs activities on SDOH and types and details of the models that we trained. So the agenda will be, I will start by defining the SDOH first, then I will talk about the functions of NLP or benefits of using NLP in SDOH. Then I will talk about the SDOH studies in Johnson Hall Labs or what we do about this important subject. And then I'm going to talk about the types of the models that we trained and use. And then finally, I will talk about future work. So CDC defines the US life expectancy is decreasing even as the medical care advances. So that's a huge subject. So see, there are a lot of research on medical care and still the life expectancy is decreasing. And this may be partly due to the decline in SDOH. So the CDC definition, and the CDC got the definition from World Health Organization. The definition for SDOH is conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. So they are mostly non-medical factors that influence health outcomes. So just to give you an idea about the basic SDOH, these are very important in the person's health beyond diseases and drugs. So you may say personal safety, housing, substance use, employment, literacy, freedom, access to healthy food, and so on. So these, what I said, these SDOH are rarely available in structured health data. You don't get them from the ICD-10 codes or diagnosis codes, but they are mostly in the unstructured narrative clinical notes. So if a patient is experiencing substance abuse, unemployment, homelessness, or similar, those will be in the free text notes. So the NLP, we will use NLP to find these SDOH factors. So NLP brings natural language understanding to software, allowing more human-like communication and unlocking insights from vast amounts of text data. NLP made it easier to start correlating social determinants to patients' health, and it has the potential to vastly improve prevention and treatment. So what we do as Johnson Hall Labs? Johnson Hall Labs already has a huge NLP library about healthcare. It's the most widely used tool in the healthcare and life science industries. So the last time I counted, it was we had more than 11,000 models. More than 2,000 are about healthcare, and it's increasing daily. So we provide models to understand or to extract SDOH information from unstructured data, which is just text. And we try to identify at-risk populations, and we try to address health disparities. So basically, we have these 4 types of models: the named entity recognition, NER models, and then text classification models, and we have an assertion model. And to make life easier, we just have pre-trained pipelines that you can easily plug and play. So NER model, definition of an NER model is, it's a type of NLP model. It's used to identify and extract named entities, like proper nouns that refer to specific people, organization, location, date, quantity, based on your need, from just text. So what you see in the screen is, okay, we use the visualizer. We have a visualizing library, and you can see that some of the words, or they may be called chunks, are marked by the visualizer. These chunks are first detected or extracted by the NER model. Then they were labeled as, depending on, let's say, the first, you see the marijuana, so it's labeled by the model as substance use. or there is a word saying unemployed. It's very important in the patient's health. So it was marked as employment. And then there is stress, it's mental health. So the NER models will give you the most important entities. The models will extract the entities that you need and you want to extract. And this visualizer will make life easier. And we will also produce CSV or JSON files depending on what you need about the entities that we extracted. So the NER models, these deep learning models are trained on annotated data sets, and they were manually labeled with entity types like person, location, organization, etc. What you see on the screen right now is the annotation lab or NLP lab. So experts, subject matter expert, maybe medical doctors or experts on some certain domain. These people first label the text or label the important words in the text, and then we use the results of these annotations for training models. And once you get a satisfactory model, then you will use this model to extract entities, these NER models I'm talking about. And we most often frequently update these models or fine-tune these models with new data. So the NER models, right now we have 8 of them. I will discuss these today. And these are, as you see, starting from the SDOH NER, it's the workhorse model, and coming down to more specific models. So the S2H NER model is designed to detect and label all the S2H entities within text data. It's been trained using a diverse range of annotated text sources. So what you can see that this model extracts 39 different entities, starting with education, housing, eating disorder, age, disability, language. These are very important in certain cases. So this model will extract the entities related to these entities. So this model is designed, I think, yeah. Right now, what you see here is this is the metrics table of this model. You see on the left all the entities, and then the 4 columns are going to give you the precision recall, F1 score, and the support. So you can see at the bottom that the micro average F1 score of this model is 94%. This is quite satisfactory. It's a very good NER model. It's dependable. But you will see that the F1 score for different entities may be different. So it may be related to entity to be extracted very not so easily. There may be not many support entities. So you see employment has more than 2,000 support. So it may be easier to understand these entities, but some of them are more difficult to understand, like quality of life. Even humans can have difficulty in understanding this entity. But still, it's a very good model. Almost you can call it perfect. So let's take a look at an example here. This is the text about a patient, starting with this patient is 55 years old, living in New York, and then goes all the way. And once we apply our S2H model using Spark NLP annotators, you will see that all the chunks that are detected by entities are shown here, starting with the 55 years old. It's an age, and the confidence level that the model labels it as age is over 95%. And we have the option to define a threshold. So let's say you may say, okay, do not get me chunks below 50%. And as you can see, there is only one chunk that is below 50%, and it is just the health insurance, it's insurance status. So the model worked fine. The model extracted all the entities related to S2H from the text or unstructured data. And you can, as I said before, you can use the visualizer, NER visualizer, to have a perfect view of the entities that we extracted. So you may use blacklist. You may say that, okay, there are too many genders. I can easily understand she, woman, her. So you can blacklist them, and then you will see less entities. but it will be a more compact type of extraction, and you will see maybe more important entities over here. So let's switch to another model. This model is about extracting demographic entities. So these 7 entities are extracted by this model. The previous one, the workhorse model SDOH and NLP, extracted 39 different entities. This model extracted only 7 entities, and the metrics are, as I said, this one is almost perfect, so it's working quite good. And again, we make an example. We use a different text here. You can see that this model extracted all the entities that are needed by the demographics model. And you can easily see at a screen or at a screenshot all you need from this model. And I will go back just a little to say that, okay, at the right, you see the results. You may just use the visualizer to get the results, or you can define this table or data frame and then save as a CSV or Excel file or JSON file, and then use for your, let's say, future studies. So visualizer is perfect, but this CSV file will be very important also. So the next one is about the community condition. So this model will extract the entities as shown on the screen. The model will extract transportation, housing, community living conditions, food insecurity, and environmental condition. Again, the metrics say that this model is working quite good. And again, a different text here. What you see here is, okay, this model extracted very important entities here. Check the housing, let's say. You will see that, okay, the small apartment was extracted by the model and labeled as housing, and then comes healthy food. It's again food insecurity, and then there are different entities like the community safety, which says that, okay, unsafe neighborhood chunk is extracted as a community safety. It's very useful. Okay, the other one is social environment. The entities that this model is going to get you is social support, social exclusion, childhood event, violence or abuse, legal issues, and the metrics are right here. So again, the micro F1 score is over 90%, so it's quite good. So let's take a look at the other ones. So you see that the social support, violence or abuse are extracted. Legal issues, the person is in prison, so it was extracted. And physical abuse or emotional abuse, they are all extracted. And you may say, okay, why don't I see the gender, because there are a lot of she, he words here. But remember, this model only gets you the social environment type of entity. So if you want to get the gender or other things that you are interested in, then you will have to use the SDOH NER model or similar one in together with this model. If you may want, you may use more than one model in Spark NLP. So substance use is quite important right now. So this model is gonna detect alcohol, smoking, and then comes 4 different entities all related to substance use. And the first one is going to be substance use, then the quantity of the substance that the person is using, then the substance frequency, the frequency that the person is using, and how long the person has been using this substance. So you will see that it will be very difficult for the model to understand the difference between different substance entities, but this model is working quite fine. As you see, some of them are some of the F1 scores are almost perfect. And I will show you the next visualizer, but let's try to stress on different substance based entities. So substance quantity, I'm starting with the first one, 5 to 6. Okay, it's quantity. And again, one pack per day. And these are all quantities. So what I mean by substance duration is, okay, this person has been using the substance for the last 5 years or past 28 years. This is, okay, substance duration is quite good. And the other one is frequency, though. So the person is using the substance for let's say occasionally or per month or daily. So again, the model works quite fine, and the expected was cocaine. It's also extracted by the model. So the next model is going to be access to healthcare. It's quite important. We know that okay, the healthcare is over there, but we want to understand if the person has access to that healthcare. So this model is going to get you these three different entities: access to care, insurance status, which is quite important also, and the healthcare institution. And the metrics of the model are right here. So let's take a look at this one. Okay, so rehab or access to adequate healthcare is extracted, and you see the insurance status, the model extracted uninsured or Medicare or private health insurance, and the healthcare institution is going to be either a clinic or medical center or a hospital, and they are extracted by the model. So the next NER model is going to be the health behaviors and problems, and the entities are quite a number of entities right now. It's 12 entities, starting with diet, exercise, obesity, hypertension, all the way goes to disability. And you may expect a little drop in the metrics, but still it's over 91%. So it's a good value. It's a good F1 score, satisfactory. So let's take a look at another text. So we run the model here, and you will see that the exercise, it may be either a regular exercise or tennis, basketball, gym. They are all extracted. And let's see, some mental health issues like anxiety or depression are extracted. Disability is over there. And one thing about hypertension, the hypertension is extracted as a word, and high BP, high blood pressure is also extracted. So different uses of the illness are also extracted. And the other model is about income and social status. So this model is gonna extract these 5 entities like education, employment, financial status, marital status, and population group. And again, this model is working fine. Let's see the results in an example here. So starting by patient is described as divorced or divorced, and it's immediately extracted as marital status, and then comes some entities about employment, construction worker or plumber. And again, the income, it's low income or just below that, the income value of $1,200 per month. It's easily understood. Financial difficulties and financial problems are extracted as financial status. So this work is doing its job. So these are the 8 NER models. And remember, what we expect from the NER model is the NER model is going to find the entities that you want to extract, and then it will prepare a report, and then you're going to get this report as CSV file or JSON file, and then use for the next studies. So text classification is somewhat different. It's the task of assigning categories or labels to text according to its content. The goal is to automatically classify or sort the text data. There will be predefined classes. We will discuss them. And text classification is maybe sometimes tough. The text may be too long, too short, too, let's say, too much slang in it, and too many, let's say, special characters. But these models are working fine. So we have, what you see here is on the screen, we have 7 different text classification models, and 3 of them are about insurance. And these insurance, the medical insurance is quite important here in the USA. So we have 3 different models about analyzing these the entity, or excuse me, the insurance status of the person. So let's go one by one. Housing insecurity. It's the name implies if the person is unstable or inadequate housing, and it may have an impact on the person's health and well-being. So if the person, the model is trying to find if the person has stable, affordable, quality housing, and otherwise, if not, it will be a problem in the person's health. So again, what you see here is almost 250 words, and I highlighted the section that the model used for making this decision. So the housing insecurity, there are two labels here. One of them is housing insecurity, which means that the patient has some housing problems, or otherwise the no housing insecurity or not mentioned means that the patient has no housing problems or there is no mention of it in the text. So let's check the highlighted zone. You see that the clinician, the doctor made some notes about the patient's housing situation, and the decision of the doctor was the apartment building is in good condition and no immediate environmental hazards. So you expect the model to define or to select no housing insecurity. Okay, we get it correct. And the classification confidence is over 90%. The next model is about mental health. It's about the person's emotional, psychological, social well-being. It's not just the absence of mental illness. So it's very much affected by the social, economic, and environmental factors. So let's take an example. Again, a long text about James. So we expect there are two labels here. One of them is mental disorder. So there will be, if the label is mental disorder, it means that the person has some mental health problems. Or no or not mentioned means that there are no mental health problems or they are not mentioned at all. So the highlighted section, you will see that James' symptoms of schizophrenia or delusion, hallucination, disorganized speech, behavior, negative symptoms. So we will see that the person has mental disorder, and the confidence of the model is okay, almost perfect, because there are five different words which all point to the mental health problem of this person. So the next model is under treatment. We try to understand by using this model if the patient is under treatment, which means that the patient is getting actively getting care and services for a health condition, for a possible health condition. So this is quite important. It's critical as shown on the screen for managing both acute and chronic diseases and conditions. So again, this time the text is shorter and the labels it's again two labels only. It's if the model is going to decide if the person is under treatment or not under treatment, or it's not mentioned in the text at all. So the highlighted section, just check the highlighted section. We see that the doctor made some recommendations before to John, the patient, about the risks of leaving the blockage untreated, but John chose not to pursue any treatment. So, as you may guess, the classification will be not under treatment, and the confidence level is over 83%. So, okay, this is the first of the insurance-related classification models. So, we are gonna by using this model, we will find out if the person has insurance coverage or not. So it's the person's insurance coverage is very important on the person's health. So we are gonna try to understand the person's situation insurance-wise. So this model is gonna show you there are more than two labels now. If the person is insured or uninsured, or unknown, which means that it's not mentioned in the clinical notes. So again, we get this highlight was too long, but I will get to the second sentence of the highlight. So she works as a part-time sales associate at a retail store and has no medical insurance. So it means that the person is not insured, so uninsured, and the confidence is pretty high, or almost 98%. So the second insurance-related classification model is insurance coverage. So the person may have the medical insurance, but the level of the coverage is very important. So we will use this model. As you can see, the labels are the insurance covers all or most of the medications, which is called or labeled as good. And the second option is there is poor. The insurance does not cover all medications or doctor visits or other medications, prescription medications. So it may have probably have a negative effect on the patient's treatment. And unknown is there is no mention of this in the text. So again, going to the highlighted zone, you see that the patient already has the Medicaid coverage, but it's poor. So and which means that the insurance does not cover all the needs of the patient. So, and the patient also does not have the financial resources. So this is a huge problem on the patient's SDOH. So as expected, the insurance coverage is labeled as poor and the confidence is over 75%. The last insurance tax classification model is the type of the insurance. So the patient has an insurance coverage, but the type is also important. We will just discuss them. So the patient has an coverage, but it may be Medicaid, Medicare, private, the employment or employer's insurance. So these all have an effect on the patient's SDOH. So again, we have a text here. Let's see the labels first. This time we have 6 different labels. Like the first one is employer, which means that the employer covers or provides the insurance. So then comes the Medicaid and Medicare, or the patient is maybe in the military and he has military insurance, or he or she is paying for the private insurance or other, which means that it's not mentioned in the clinical notes or it's not known. So again, take a look at this text. So insurance status is discussed here as a separate section with a header, insurance status. The patient has private insurance, which provides comprehensive coverage for her medical care. So good news, the model already labeled this as private, which is correct, and it's almost 99%. The last tax classification model is transportation insecurity. So it is quite important, which means that, okay, the patient has housing, but if he has no access to public transportation, or maybe the patient has no car, or he cannot drive a car, so this patient will have problems in accessing healthcare, employment, education, food, and these will all affect the person's healthcare. So this time, starting with the labels, the first one is no transportation insecurity or unknown, which means that, okay, the patient is fine. He has public transportation, or he's driving, or someone is driving for him, or it's not mentioned in the text. And the second one is bad news, transportation insecurity. So the patient has transportation insecurity, which may lead to medical problems. So we have the text here, and this time the final sentence, which makes text classification more difficult. The final sentence is related to person's transportation insecurity. You may see that the patient John is living far away from the hospital and there are no available train services. So this means that the patient has the model labeled the result as the patient has transportation insecurity, and the confidence is around 85%. So the next type of models is assertion models. Assertion models are quite important in NLP. These models are used with the NER models. They are techniques for detecting the assertion status. So whether the NER model extracts the entity or statement, but sometimes it may be negative. So this assertion models is going to give you if the entity that was extracted by the NER model is absent, present, or someone else, past, hypothetical, or possible. The name of the assertion model that we use is Assertion, SDOH, WIP. WIP means that there is work in progress on this model. We want to increase the metrics of this model. You can see on the metrics table that, or on the right, that some of the entities need some more work, and we are working on this. So this will give you, this visualizer will give you a perfect idea. So it's similar to NER visualizer, but this one is assertion visualizer. So what you see here is, let's say, okay, we have like here type 2 diabetes right here. So first the NER model extracted type 2 diabetes, labeled as other disease. So NER model worked just fine. And then comes the assertion model, and the second label is performed by the assertion model, and the assertion model labeled as present. So let's take a look at an absent here. So you see that, okay, transportation, this chunk or word is extracted by the NER model as transportation, labeled as transportation, which is correct. But it was this time labeled as absent by the assertion model. And the reason is, you can see that just before the transportation, the word transportation, there is lack of, which means negative, so it's absent. Also, the next one is absent again. You can see that access to healthcare, but the word before this, access to healthcare, is unable to, so which again means that there's a negative here, and the assertion model just labeled as absent. These assertion models are quite important, because if you, in some cases, if you just use the NER model, you will extract all the entities. But as you can see, some of them are not present. So like this one, this is another good example. Health insurance, the NER model said insurance status, okay, but it's absent because there is the word lacking here. And the other one is healthy food. It's food insecurity, labeled as food insecurity by the NER model. But the absent is the, let's say, game changer here. It's the assertion model labeled as the absent, because there is, you can see that there is limited access to affordable healthy food. So assertion models are sometimes quite important. If you don't use them, you're going to get a CSV file with all these entities, but some of them are, as you can see, not even present. So quite good. And you may see that this is the reason we are working, or my colleague Halil is working on these models. He made a good job. He trained almost all of these models, and he is working on these models constantly. So the final models are pre-trained pipelines. Let's say you just don't want to play too much with the model. You want to get a solution like a plug and play. You will use these pre-trained pipelines and then get the results. So what I mean is, okay, like we have this pre-trained pipeline named NER Profiling SDOH. Normally, what you see on the screen is the NER model. So we use the medical NER model annotator here. So we have the stages. So this is the basic Spark NLP pipeline. We start with the first stage document assembler. Then the second stage, we get the sentences. And then we use the tokenizer to get all the tokens, which means all the words, punctuations, special characters, and so on. And then we represent them as high dimensional vectors by using the word embeddings model annotator. And this is very important. This is the name of the embeddings model. It's a perfect, almost perfect model. And the stage number 5 is where you apply the NER model. So in this stage, you see that as we used SDOH, income social status model. And then we use the 6th stage NER converter internal to get the results as chunk. And then you define these stages as 6 stages right here. There are pros and cons. The pros is there are many different parameters you can use with these annotators. So you may say that, okay, I don't want to see all the income social status, then you will use blacklist. Or you want to see these certain ones, certain entities, then you will use whitelist. Or you may decide to define a threshold so that you will only see the entities which have very high confidence level. Then you have a parameter for this. And again, you may say that, okay, this model is not able to find certain entities, then you will use text matcher, add this text matcher as an additional stage. So this is almost the best solution. But sometimes you don't want to use them. You don't want to use these stages, and this time you will use the pre-trained pipeline. Okay, this pre-trained pipeline is, as I said, plug and play. You just use it, NER profiling SDOH, and this pre-trained pipeline with one line of code, except the importing of the pre-trained pipeline. And then with one line of code, you will get the result, like this one. You just use the NER SDOH mentions pipeline here, and you get all the results that you need. But you have limited capability to play with the model here. You just use the NER SDOH mentions pipeline, and then you will get the results. If you want to work on the results, then you have to use the previous models. So the future work, as a result, the future work in the John Snow Labs activity about SDOH is we are planning to extend the data set and to fine-tune the models. We are trying to refrain from bias, probably add some new entities, maybe few. But this model training is a constant improvement, needs constant improvement. So these models will be trained constantly to get the best, almost perfect results. So thank you for listening to me. If you have any questions, I'm right here waiting for you. Thank you.